Why hip mobility matters.
Healthy hips are key for movement, balance, and comfort in daily life. Tight hips can lead to back pain, stiffness, or difficulty standing up and walking. Improving hip mobility helps you move freely, reduces discomfort, and supports overall fitness. You don't need fancy equipment. Just a little time and some simple exercises can make a big difference.
Warming up safely.
Always begin with a gentle warm-up to prepare your hips. Try light marches in place, hip circles, or slow side steps for a few minutes. Warming up increases blood flow, loosens tight muscles, and helps prevent injuries. Keep movements slow and controlled, focusing on comfort rather than speed or intensity.
Simple stretches for hip flexibility.
Stretching your hips can relieve tightness and improve flexibility. Start with a seated figure 4 stretch. Sit on the floor, cross one ankle over your opposite knee, and gently lean forward. Hold for 20 to 30 seconds, then switch sides. Another option is the kneeling hip flexor stretch. Kneel on one knee and gently push your hips forward, feeling the stretch in the front of your hip.
Easy hip mobility exercises.
Incorporate dynamic movements for greater mobility. Try lying leg swings by lying on your back and slowly swinging one leg side to side. Standing hip circles are also helpful. Stand with feet hip-width apart and slowly rotate each leg in a large circle. These gentle actions promote smoother movement and keep your joints healthy.
Tips for lasting results.
Consistency is key for improving hip mobility. Aim to practice these exercises at least 3 times a week. Listen to your body. Mild discomfort can be normal, but stop if you feel pain. Combine mobility work with everyday movement, like standing up to stretch during breaks. Over time, you'll notice greater comfort, flexibility, and a more active lifestyle.